Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast for people with diabetes. The goal of our podcast today and every day is to empower you with knowledge. Today, we're going to be focusing on foot care, that important part of our body that most of us take for granted as we're walking around or sitting with our legs up watching TV or whatever, and we take it for granted until there's a problem. And if you have diabetes, you need to pay special attention to your feet because they are at risk of problems. And like most things, if you take care of them, they will take care of you. I'm your host, Dr. Neil Skolnik, professor of family and community medicine at the Sidney Kimmel Medical College of Thomas Jefferson University. I'm also associate director of the Family Medicine Residency program at Jefferson Health Abington. And joining me today, as always, is my wonderful co-host and friend, Lucia Novak. Lucia?
Thank you, Neil. And hello, everyone out there, and welcome to today's podcast. I am practicing right outside of Washington, D.C., our nation's capital, and I am looking forward to this conversation because your feet are very near and dear to my heart.
Also joining us today is Dr. Cyaandi, who is the Director of Podiatry and Director of the Diabetic Foot Clinic at Oregon Health and Science University. Dr. Dove specializes in wound care, limb preservation, and diabetic foot care, and has served as a principal investigator in over 50 clinical trials over the past 20 years. For those of you who are not familiar with clinical trials, I can tell you that is very impressive. Welcome, Cy.
Thank you for having me. I'm very excited to be having this conversation and educating our patients on what they can do to prevent the problems or complications because of their diabetes.
And Cy, I love the way that you just said that, educating patients about what they can do. Because while we spend a lot of time thinking about this, and while of course we will talk about what we as clinicians do in the exam room, it's really about what about people who live with diabetes can do for themselves that makes the biggest difference with regard to outcomes. Now, foot health is something that people with diabetes may not always think about until there's a problem. Why is it really such an important part of overall diabetes care? We think all the time about blood sugar. We don't think all the time about feet. Why are the feet so important here?
Not to be too simplistic, but it's sometimes the case, out of sight, out of mind. And then also there's a lot of fear. Patients may tend to avoid the unknown. There are a lot of people in their lives who give vague suggestions or medical advice. It's not always true. So in my experience, I have a lot of patients who come to me and they're terrified. They may be coming for their initial visit, and I like to put them into a risk category. Your chances of losing a toe or having a sore are 0%, low, medium, or high. But if no one is advocating, if your primary care doctor is not advocating for you to go see a podiatrist, the patient may think they're fine while they may not be fine.
And when you say that putting them in percent risk of losing a toe, that's a nice entry to that background of what are some of the complications that can happen if we don't pay attention? Why do we pay such close attention?
So long before a patient loses a toe or suffers from an ulcer, we have to think of the diabetic foot as a part of the bigger picture. It's not just a person with diabetes who has an ulcer. It's actually a sequela of everything that's going on. So long before the patient loses sensation, they may have signs that a podiatrist or someone else in wound care will notice. They will start to have hammer toes, claw toes, deformities in their toes. They may develop very dry skin that's flaky, many, many signs and symptoms. And then ultimately, they may develop loss of sensation in their foot. And when you lose that sensation, unfortunately, that's when you are on the potential pathway to having an ulceration.
And so that loss of sensation occurs more often in people with diabetes than in people who don't have diabetes. Is that correct?
That is correct. Patients now, we have very good endocrinologists, family medicine, internal medicine doctors who are very good at managing our patients. However, even with excellent medical management, the patients can still have the sequela or the complications, such as numbness in their feet and in their toes, that is going to develop very slowly and in a very insidious fashion where they may not realize that they have numbness on their feet.
Yeah, it's interesting, Lucia. I'm sure you've seen this as well, where someone might unfortunately come in not realizing that they have an ulcer because they didn't feel it. Is that correct?
Oh, yeah. There's been many times that I have discovered things. And so one of the things that we put in place in our office is I have signs that are up in the office that are in, I don't know how many different languages that say, when you enter, please remove socks and shoes, because they are going to get a foot exam when I am going to be seeing them. And I have many patients that will say to me, "Hey, Lucia, this is the first time anyone that I'm seeing for my diabetes has wanted to look at my feet." And another issue that they bring up is they are extremely frightened or concerned because they have the neuropathy. And I'm reassuring them that, having peripheral neuropathy is uncomfortable. It increases risk. It causes all kinds of issues, makes you at risk for falls. But it's not the only predisposing thing that will lead to an ulcer. And so hence why it's even more important for them to then pay attention to their feet. And so if you can talk about what they should expect in the visit when they are seeing their primary provider for their diabetes, and then how does that differ when they're seeing you, and what things can patients do at home, because we only see them once every 3 months. What can they do at home to make sure that they're not missing anything?
Well, Lucia, you said something that was music to my ears. And I understand that internal medicine docs, family medicine, just primary care providers in general, everyone's under time constraints. So I absolutely love it when someone else takes the time to just do a basic screening. But the biggest issue or the biggest thing that patients can do to help themselves, very simple things, looking at your feet twice a day, which I will say is not always that simple because it depends on who you have in your support circle. If you have a partner or you have children, if the patient can't get down to look at their feet themselves, that's okay. Have your family member or a friend or a neighbor do it for you twice a day. Simple things like getting into that habit of monitoring your feet. If you can't do it visually, because we know a lot of our patients, they may have a big midsection, which makes it very difficult to bend down, or they may have complications affecting their eyesight where they can't really see, even if they can feel their feet once or twice a day, preferably twice a day. They should also really be making sure that they have the proper shoes and socks. So as far as socks go, we want something that is not too tight, seamless socks if you have access to them, and also a white sock. So if there is a wound or drainage or a blister, they can actually see something on the sock that will alert them. And shoes, I could talk, all day about shoes because I am a podiatrist, but you want a good pair of orthopedic shoes, whether you have neuropathy or not, because I believe in setting up good habits for my patients in case they develop some of the complications.
That's a good point. I was so happy that you mentioned that for some people, it's just physically hard to see the underside of their feet. One of the things that I will recommend to patients, actually to all patients, just makes it easier, is they have either a mirror that's kind of the way we take selfies, on an extended pole that allows you to then look at the bottom of your feet very easily. And I've seen this both at Walmart and at Amazon, that a mirror that is on a tilt, that you can then put your foot in front of. It's on the ground and you can just see the bottom of your foot, and things like that, which people don't always think of naturally, or helpful things for people to be aware of, to facilitate making it easy, because making things easy is an important part of good care. Lucia, I love what you said about people taking their shoes off when they get to the office. And it's something for our listeners to remember. You also said that sometimes people have told you you're the first person who looked at their feet. Well, guess what? If you are in your clinician's office and you're barefoot, they're going to look at your feet. Right. And a lot of times, even though we have a right as patients to expect excellent care, we don't realize the stresses that the clinicians are under. And if someone sees 15 people in a morning, and it takes a minute or two to take one's shoes off, you add that up, 15 people, that's suddenly 20 minutes of time. It's real. And so the degree to which we can make it easy for each other to both give and get excellent care, we end up with better outcomes. Do you have any other hints, Lucia, that you talk to patients about?
I love to tell them, I love the neuropathies. That's just been one of the areas of diabetes that I have really done a lot of study, and I do a lot of talks on it as well. And making sure that our patients leave this earth with everything they have when they were put on the earth is what my goal is for them. And telling them to shake out their shoes before they put their shoes on. What you mentioned about having appropriate foot care, I tell them you wouldn't go tap dancing with ballet shoes. So why would you go walking with running shoes? So it's a very different shoe. It's going to offer different types of support, and making sure that they clean their shoes, like air them out after they've worn them, spray them down with some Lysol, letting them dry before they put their foot back in them, just to kill any germs that might be in there. But I also tell them that if they have any concerns about their nails, where the nails are really thick and a typical nail clipper isn't going to do it, if they find themselves going to the garage or their workbench for a device that they would use to clip the hedges, that is the red warning flag to not do anything to their feet. That any clipping, any filing, all of those kind of things really should be done by someone who can look at their feet effectively, can handle the devices to clip safely. And it doesn't have to be a healthcare provider. It can be a family member that has good vision and good dexterity. But, there are certain things I tell them they're not to do bathroom butchering on themselves. We want to keep them safe. And I also tell them, just because you're going to see me in 3 weeks doesn't mean you wait 3 weeks to alert me that you have a problem with your foot. Because even if I can't do anything about it, I can expedite an appointment to a podiatrist.
Boy, that's such a good point. Cy, are there certain red flags or things that people should be aware of that they ought to get in touch with us about?
So I always try to keep it very simple for patients, because having diabetes in and of itself, there's a lot of anxiety. It's a very hard disease to manage, and no matter what they do, it's never going to be perfect. Or if they reach that perfect A1C, it may last for a few months and then kind of drift off. So with diabetes and looking at their feet, I say to the patients, if you see something red, hot, or swollen, go see your healthcare provider or podiatrist immediately. If you think you stepped on something, but you're not sure, but it's a little bit tender, go see your podiatrist immediately. And one of the biggest red flags is if you have a patient who normally has no sensation and they have new onset pain in their foot and they're not sure why, they should see their podiatrist immediately. And usually podiatrists will see that patient ASAP because time is tissue. When there's a question of an infection, we want to see them sooner than later.
Excellent.
I love
Really,
that time is tissue.
Yeah.
Perfect.
yeah, and it is so important because people need to understand that they can't use those same signals that we have become used to using before having diabetes because of that peripheral neuropathy. And that, normally, and Lucia, you mentioned something in your shoe. We've all had things in our shoe and it's uncomfortable. But the idea of checking that shoe, because you might not even notice that you have that small pebble in the shoe or imperfection, so that when it's in there all day long, it doesn't take long for it to erode through the skin, particularly in someone who also has a bit of decreased blood flow, as also happens as someone has diabetes for many years, as can happen. And that combination of neuropathy and decreased blood flow with even something small in their shoe can be devastating. Cy, regularly people will go to their primary care clinician or endocrinologist, the person who cares for their diabetes. And certainly those clinicians are trained in good foot care, as Lucia was talking about, regularly are doing a foot exam, both for sensation and for vascular integrity, checking pulses, looking to make sure there are no ulcers. So this is all really very important. And we know that unequivocally, people with diabetes need to be getting regular foot exams when they go for care. Cy, when should they specifically be asking to see a podiatrist if they haven't been already referred to one?
When you start to see pathology, specifically loss of sensation, which we call protective threshold, that's when the patient should be referred to a podiatrist so that we can see what measures can be taken to alleviate their risk, also to give the patient proper education and look at any other modalities or treatments that they may need down the line.
It's so important. And, Lucia, you and I talk a lot about empowerment on this podcast. And as I'm listening, there are two critical things that our listeners need to come away with. One is to have that foot exam on a regular basis, certainly at least annually, if there have been any complications, at least every 3 months, from whoever it is that provides their care for their diabetes. And this is to everyone out there. If you are not getting that exam, you use that hint given by Lucia. Take your shoes and socks off when you get into the room. And then you can remind the clinician that I heard on this podcast from the ADA that I need that foot exam. No one will ever say no. Everyone are human beings. If we're 4 people behind and in a rush, sometimes we might not do the things that we on our best days strive to do. So 1, make sure we're getting that regular foot exam. And 2, if you have any of the things that Cy mentioned, peripheral neuropathy or peripheral vascular disease or a history of an ulcer, ask to see a podiatrist because podiatrists have a lot to offer, which, Cy, brings me to my next question for you. For the average person, what are those special things that you offer?
So as a podiatrist, we want to look at the skin in a series of symptoms. A lot of our patients with diabetes, they tend to have components such as athlete's foot or just very dry skin and calluses and thick toenails. We have a lot of oral and topical medications to alleviate that. Keeping the skin supple and soft with good elasticity is very, very, very important. On some of the other modalities we have are things such as surgery, which is not always our first recommendation, But if I see a patient who comes in with a pressure point in their foot and they've had a history of ulcerations, sometimes we will surgically rebalance the foot so the risk is not there. But a big part of what we do also are diabetic shoes. For our patients who have poor or decreased sensation, the shoes are critical in terms of preventing ulcerations. If they've had an ulceration, to keep it healed, or if they have neuropathy, they've never had an ulceration, to make sure that they don't have an ulceration in the future. Those are sort of the most critical things that we as podiatrists do for our patients with neuropathy.
I'm so glad you mentioned about the diabetic shoes because they are so important. I have some patients who think that they can just get, sneakers that are comfortable. And especially if you out there have thick nails, we can purchase shoes without a prescription and we can get wide shoes, but we can't get shoes that accommodate for the depth. And if you have a nail that's thick and the top of the shoe is pressing on that toe, you can develop an ulcer under the nail and not know it. So I can't stress enough the importance of seeing the podiatrist to get all of those special care pieces that don't happen in the primary care office. We don't have all of those bells and whistles, and the podiatrist does, and they have special training to be able to identify things that we as clinicians might miss.
That's a really good point. So there are shoes. Are there any particular type of socks that you recommend, Cy?
Typically, we like a white sock in case there's drainage or bloody or what we call serous. The patient can see that. Also, we want socks without a seam at the toes. And we don't want socks with a lot of elasticity in it so that they end up having indentations in their skin, which can be uncomfortable for them.
Really important points. So we're almost out of time. Cy, where can our listeners go to learn more about diabetic foot care?
So I think one of the best resources out there is the ADA website. They have a section if you cruise through their website, and you'll see some of the most practical tips as a diabetic patient that you can find for taking care of your feet, and a lot of good educational pieces as well.
Excellent. And Lucia, do you have any final thoughts for our listeners?
You can even go to Amazon and get the monofilaments that you can use to check your feet at home to see if you feel it. So I recommend that you become as engaged with your feet as possible so that we can ensure you keep them.
I love that. Engage with your feet.
Yeah.
Cy, what are your final thoughts for our listeners?
So I always tell patients, I stress that they need to advocate for themselves. If they have a problem, you bring in your circle of family and neighbors and friends, advocate. And we mentioned earlier, patients to advocate to have their feet looked at, whether it's the podiatrist, which we will look at obviously, but internal medicine, family medicine, making sure that they have that protection and that assessment oversight at all times.
So critically important. Lucia, Novak, Cy Dove, thank you both so much for joining us.
Thank you. This has been an honor and a privilege.
Thank you, Cy and Neil. And to all of you out there, take care of them tootsie toes.
And that's right. Most of all, of course, thanks go to our listeners. This is a critical topic, and I think we've learned a lot today. And let me say, consistent with our overriding theme, which is empowerment, make sure you get that foot care that is important. The easiest way to ensure you are getting that when you see the usual clinician who takes care of you is exactly what Lucia mentioned, which is you take those shoes and socks off. That's kind of nonverbal communication at its best. And if you have any of those conditions that we mentioned, peripheral neuropathy, decreased vascularity, peripheral vascular disease, or any history of ulcers, make sure that you're also seeing a podiatrist because it's all about team care. It takes a village to give any of us and all of us care. For the American Diabetes Association, I'm Dr. Neil Skolnik. Thanks for listening.